Well, here's an interesting article. I saw it actually the last day or two. It came out, and actually, these two Nobel Prize economists came out with a report that shows you every American family basically pays $8,000 a year too much for their health insurance. Okay, so that's why how you can save $8,000. This is on your annual premiums. You pay $500 a month or whatever. So that winds up, the average family, like 14, $15,000 is not unusual. But because we are the highest spending country in the world on health spending. Okay, look at this chart here. It says total spending on healthcare in 2018. And you see on the left, that red line, we spend more on healthcare than any other developed country in the world. And actually, if you go down to the second most expensive country, which is Switzerland, you could save $8,000. How do you like that? And if you go down the list, in other words, like you go to Germany or whatever, you could save an average of $12,000. So we're crazy in this country that we're all tied up and spending almost twice as much on healthcare as anybody else. So actually, the way I figure this, if you want to save $8,000, move to Switzerland. If you want to save, $10,000, you move to Germany or France or Chile or something like that. And you save like $10,000 a year on your health payments. And what's more interesting, you get better health care. Yeah, that's what's the funny thing about all this. Now, here's some data that shows how good we are at keeping people healthy in this country. And by the way, I know that's a little bit of a joke. I lead you in by the title, but you're going to save this kind of money, but you got to move. But if you hang in here, after I go through this data, I'm going to show you the best places to get free healthcare, no matter what income you are and things like that. And particularly if you don't have healthcare, or even you have healthcare and it's not being covered, I'll show you how to get that kind of help. But so hang in till I finish these little data shots. Okay, here's for infant mortality. Okay, in other words, these are the children that are dying, at infants. So how good are we at the hospital delivering babies and healthy babies and stuff like that? Okay, here we are in red over here. There's 33 countries that do it better than us. So we're number 33. Yay! We're 33. You think if we paid twice as much, we'd be number one? No way. Okay, but that's not all. Here's other data. Okay, here's another one. Life expectancy at birth. Here we are. See the little red dots in there? Okay, on the right of those red dots, see over this way, all those countries you could live in and live longer. So we're down like there's 30 some countries that where you could live and live longer. So you would pay, like $10,000 less a year in healthcare and live longer. That's crazy, isn't it? Okay, now here's another one. Life expectancy at 65. So if you're 65 years old, which I passed that 10 years ago or more, how long are you going to live? Okay, here's the data on that. Look, okay, here's the USA again in red. Down here, there the people who live shorter on the left, people who live longer on the right. Look at again, same amount of countries. So you sit there, you'd be living so much longer if you go to these other countries. That's 30 of them. Everybody says healthcare, we're number one. Nonsense. Okay, here's an interesting one about suicide rates. Okay, we're committing suicide here in this country. It is really growing, unfortunately. But look at again how we are. More people commit suicide in all the developed countries. See, all the countries they go over here are people in developed countries. So they don't pick, some little country out in the middle of nowhere that has poverty for everybody. These are developed, so middle class countries. See, all the ones that people have less suicide. Look at all those countries, yeah. And we're here, like number, 30 something again. Now deaths by cancer, we're a little better. There's only about 12 that are better than us in curing cancer. Now here's another. Oh, that's the suicide rate again. But here's an interesting data. Actually, the people who did this study won a Nobel Prize on this data here. I'm pretty sure it's this. It's the suicide rate and alcohol addiction and suicide mortality rate of white non-Hispanic people. They're the people that are killing themselves in this country. You look at these graphs here. This is age 25 to 29. See, over the last 10, 15 years, see that red line there? That's the increase in suicides for white people, between 1992 and 2017. Without, these are actually white people without a college degree. Okay, with the college degree, it pretty much level. So if you don't have a college degree and you're white, I mean, actually, I see minorities that their data doesn't look like this at all. It's white people only, where the high suicide rate for white people without a college degree. Here's the 30 to 34. Look at that, like a hockey stick going up that red line. Here it is, 35, 40. This is a bigger hockey stick. Looks like as you get older, it's going crazier. Here, 40 to 50, 50 to 54, and 56 to 59. It's like, then it trails off a little bit at 60. It's still going up though. They're getting bigger. Then it trails off at 70. By the time you get my age, I guess you don't give a shit about anything. But this is it. I think there are the people who got stuck in this country because of technology and things like that, and the jobs have changed, and those good jobs, we have to get retrained to do other things. We don't have enough help for that. Now, another thing is costs. So if we're paying $1 trillion more, and actually that's about much of student debt. In 1 year, we could eliminate all the student debt almost. And we have more student debt than credit card debt now. So if we spent what other people spend on healthcare, we could take that $1 trillion, eliminate all the student debt for people, right? And then we build more houses and things we really need. And who knows? But it'll take a while, even if they do figure out and changing it. Here's another thing about how rich the people in the healthcare industry are. Of the richest 1% in this country, so this is the top 1% of people. Okay, 16% of the top people are doctors. So the richest people in this country, 16% of them are doctors. That's 1 out of 6 people are a doctor who are gazillionaires in this country. Yeah. Now that's sort of interesting. Here's another interesting fact. In Europe, they have twice as many doctors that we have. And they get, so we have like half the number of doctors and pay them twice as much. Okay, get that? Half the number of doctors and pay them twice as much. You know what that tells me? Man, doctors have a crazy good union. They're keeping it closed, right? It's a closed union shop. We're happy, and this is doctors per capita. So they have twice as many doctors, and they pay them half as much. Yeah. So that's it's pricing. I'm sure that's what we're stuck. Okay, now let me go over the places you don't have insurance, you do have insurance, you don't have a copay, you can't pay the copay, you can't pay the deposit, all this kind. Even if you have insurance, you're still screwed financially. More people go out of debt, go into bankruptcy because of this. Here's some places to start. Okay, one is your county health department. You want dental care, health care, breast cancer, and anything, sexually transmitted diseases you're worried about, all that. Call your county health department first and find out about the free and sliding scale benefits. Okay, so that's one place to do. Another place you want to go to is www.needymeds.org. Needy, NEEDYMEDS.org. That's a good database for the whole country that shows you free and low-cost clinics and prescription drug programs and state programs that are there. That's a good website for Medicare. Another place is 211.org. Go there or call. You call 211 on the phone and talk to them. What kind of help you're in? You have a friend that needs to be rehab or something. Okay, find out about the programs locally that are available to you. And here's another interesting one. It's called clinicaltrials.gov. This is where the government gives billions of dollars, I don't know, hundreds of millions, lots of money for doctors to do research. And that's why I was going to get a single dental implant for free. It was going to charge me $3,000, $4,000, $5,000 for the dental, but they were studying it at this clinicaltrials.gov, and so it was done for free. So find out if they're, what doctors are getting grants and are looking for patients to treat that condition for free. And it's really good too for people who have conditions that aren't solved. You go 5 doctors and you're still screwed up, and you can't figure this out. Okay. Well, there's probably some special doctor getting a grant money to try to figure that out. They'd love to talk to you and pay you. They give you airfare and everything. It depends. Every program's different, stuff like that. But that's a big database, and people will help you. And if you're a Lesko Help member, what I do, I have reports for every state that not only these 4 or 5 organizations, but there's probably about 50 to 100 places to get free health care, dental care, even pet care that's available for free. So if you remember Lesko Health, get that report. Just tell me the state you need. If you're not, follow up on these sources because that's a good place to get started. And again, the last video I said about how using your phone, yeah, you just don't go on the website. Find the website, get the phone number, and call those suckers. Say, hey, how can I help with this? How can you help me with this? Okay, that's the job. Okay, and they're not going to charge you. Say you call somebody out, you find on the internet, they're going to want money from you because they got to pay Google and all that kind of stuff. Well, you know that, you're up. So go to these places first before you do anything else.